Good morning, ladies and gentlemen. Today we will talk about certain topics of hypertension and the recent guidelines. And we always start with epidemiology. If we know in Egypt, the prevalence of hypertension is about 26%. If we compare the United States, we are comparing 34%. What about the control? The control in Egypt is only 8%, whereas in America it's 30%. I wonder who is responsible for this. Is it the doctor? Is it the patient? Or is it the healthcare system? Or is it collectively all of them are responsible? We are not doing a good job. We should do more than this. The WHO reported worldwide prevalence of hypertension to be about 1 billion individuals in the year 2000. Of course, this figure has increased considerably, much more. What about mortality? Mortality worldwide, also adopted by the World Health Organization, was about 7.1 million individuals per year. 7.1 individuals per year. This is a horrible figure if you consider other diseases. So hypertension is one of the commonest leading causes of mortality all over the world. Another important topic in hypertension is the etiology. If we are going to talk about essential hypertension, we know very well that it has no definite etiology, but we have certain mechanisms. And the importance of knowing mechanisms is to give the right treatment. For example, we have the first etiology or mechanism of essential hypertension is hypervolemia with sodium retention. And what causes this? Many drugs, as we know, cause sodium retention. For instance, non-steroidal inflammatory drugs and glitazones, contraceptive pills. We also know licorice is another important cause of sodium retention, which many people in the month of Ramadan drink a lot of glyceric acid or licorice. Also, we know in chronic kidney disease, we also have sodium retention. What's the importance of knowing this mechanism? If you realize we're talking about sodium retention, therefore the ideal treatment in such a group of patients will be diuretic therapy. Number two, if we know that other mechanism is the renin-angiotensin-aldosterone system. And you know this system is very important in controlling vasoconstriction and also sodium retention through the aldosterone hormone. And if we know the mechanism is the RAAS system, therefore the treatment will be simple and giving rise to a RAAS blocker, whether an ACE inhibitor or an angiotensin receptor blocker. Coming to the third mechanism, we know in essential hypertension is the sympathetic nervous system activation. Many of our patients have a sympathetic tone which is very high, and this causes, as you know, tachycardia and hypertension. This group of patients, of course, when you know there is sympathetic overtone, your treatment will be, of course, a beta blocker. And the fourth mechanism, which will be rather difficult, is the genetic factor in causing hypertension. And this factor is important and usually missed. It is about 40% of patients with essential hypertension have a family history of hypertension. So we always have to ask in the history to ask about the family history. What are the dangers of hypertension? The dangers of hypertension start with left ventricular hypertrophy. And left ventricular hypertrophy is an independent risk factor for survival. And number two, the dangers of hypertension are heart failure. Starting with diastolic heart failure, going into systolic heart failure, going into congestive heart failure. The brain is another target for hypertension in which many patients suffer from transient ischemic attacks or even stroke. The third organ which is important in the dangers of hypertension is the kidney, which start by, of course, as we all know, albuminuria, and then it progresses to heavy albuminuria and end-stage renal disease. Many patients will be subjected to renal dialysis and even renal transplantation. This, of course, is a very costly complication. The eye, the retina, we have frequently considered the blindness. In the lower limbs, gangrene. In the aorta, we can have dissection, aortic dissection. In the heart, we can have dangerous ventricular arrhythmias or even atrial fibrillation. And lastly and not least, the myocardial infarction. Well, we have finished this part of the essential hypertension mechanisms.